Hey everyone, and welcome to RUBIN'S Mind Lab, where we break down the latest research into what it really means. Ever wonder why some people seem to have health totally under control while others struggle even when they want to be healthy? Well, this new study might have some fascinating clues. Researchers are seeing that even though people want to be healthy, health disparities between people with different socioeconomic backgrounds persist. It is not usually because people don't care about their health. Instead, it seems like other urgent demands in life get in the way. Traditional health studies often look at just one health behavior like exercising or eating well. But what if the problem is bigger than that? What if it is about all the different goals people juggle every single day? This is where our study comes in. The researchers wanted to see what daily goals people with different levels of education were pursuing. They also wanted to know if health was a major reason for these goals and how people actually felt about these goals. So how did they do it? They asked a bunch of people about their daily goals. Specifically, they asked people to list between 6 and 15 goals they were currently working on in their lives. Then they picked their 6 most important goals and rated them on all sorts of things, like how much control they felt they had, how much they enjoyed it, and how difficult it was. They also asked if health was a primary reason for pursuing each goal and if the goal helped their health. They looked at people with low, middle, and high education levels to see if there were differences. And here is what they found. Interestingly, physical health goals were common for everyone, no matter their education level. But here is a big difference. People with lower levels of education were much more likely to say that health was a main reason for pursuing many of their everyday goals. Think about it. It is not that they're less motivated to be healthy. It is that health is woven into many different aspects of their lives. They also found that people pursued similar types of goals overall and generally felt about them in similar ways. However, people with lower education levels tended to have more household-related goals, things like managing the home and family. And here is something quite surprising. Those with lower education levels experienced their goals as less demanding. Now that might sound like a good thing, but the researchers suggest it might mean people in lower socioeconomic positions are setting more achievable goals within their circumstances. They might not be setting as many challenging goals because they have fewer resources. Imagine trying to plan a rigorous exercise routine when you are worried about paying bills or unpredictable work schedules. So what does this all mean? The most important takeaway is that people in lower socioeconomic positions are definitely motivated to be healthy. The problem isn't a lack of motivation, it is that their health goals might be embedded in other parts of their lives and they might be facing more constraints. This suggests that health interventions need to be smarter. Instead of just telling people to exercise more or eat better, we should look at the goals people are already pursuing. Can we help people find ways to make their existing daily goals also health supportive? For example, if someone's main goal is managing their household, maybe we can find ways for them to incorporate more healthy eating within that routine. Or if their goal is to spend time with family, we can look for ways to make those activities also physically active. This approach respects people's daily realities rather than asking them to add more on top of an already full plate. It is also interesting to think about the experience of goals. The study found that when accounting for age, the idea that people with lower education found their goals less demanding started to disappear. This points to a generational difference where perhaps older generations with lower education faced different societal expectations and had fewer resources. This highlights how complex socioeconomic status can be and how it interacts with other factors like age. The study also touched on social factors. While the findings weren't totally consistent, they suggested that the social side of pursuing goals can differ based on socioeconomic position. Since social well-being is a big part of health, for many people incorporating social connections into health interventions could be a really good move. Of course, no study is perfect. One limitation of this research is that it was cross-sectional, meaning it looked at a snapshot in time. We can't definitively say if certain goals lead to certain health outcomes or vice versa. Future research could follow people over time to really understand these dynamics. Also, the way people wrote down their goals might favor those with better writing skills, which can be more common in higher education. So that is something to keep in mind. Overall, this research is a powerful reminder that understanding health behavior means looking beyond simple advice and considering the whole picture of people's lives. It tells us that people with lower socioeconomic positions are motivated to be healthy, but they need interventions that are tailored to their unique daily realities and priorities. So instead of just telling people to try harder, let's focus on how we can support their existing efforts and weave health into the fabric of their everyday lives. What do you think about these findings? Do you find yourself juggling many goals and trying to fit in health? Let us know in the comments below. If you found this video helpful, give it a thumbs up and subscribe to RUBIN'S Mind Lab for more deep dives into fascinating research. Thanks for watching and we'll see you next time.